Greetings from Regional Health Command Europe. I want to take a few minutes to give you another update on one of my command's top health and safety priorities, COVID-19 and our ongoing COVID vaccination efforts at our Army medical treatment facilities. We have made great progress in vaccinating our healthcare workers, first responders, our deployable forces, and other mission essential personnel like teachers and vital installation service support staff. To date, we have administered over 20,000 vaccine doses and fully vaccinated more than 10,000 people in our communities across Europe. Please keep in mind that we still have a ways to go to complete vaccinations for this population of individuals. But as we continue to receive more vaccine, we'll move through this group as quickly as possible to begin vaccinating our healthy population. This has been accomplished through a tiered distribution process that prioritizes those most at risk for contracting COVID-19 and those who are most vulnerable. I realize that many of you in our military communities are anxiously waiting the opportunity to be vaccinated. However, even as the current demand for the COVID vaccine continues to outweigh the supply, we anticipate distribution will start ramping up again in early April, and our MTFs are poised to continue administering vaccines according to the DoD's prioritization schema. Our senior military leaders here in Europe are working very hard with the Department of the Army to get us more vaccine. As you all know, there is a great demand for vaccine worldwide, and vaccine production by multiple companies is just starting to ramp up to sufficiently meet that demand. For those of you waiting on your second dose of the Moderna vaccine, we are doing everything in our power to get you those vaccines within the 42-day window the manufacturer recommends. If we can't for some reason, you will not have to start your vaccine series over again, and we will ensure you are prioritized to receive your second dose as soon as possible. I'm confident that even if you get the second shot a few weeks late, you'll be afforded great protection against COVID. But please don't skip it. The Moderna vaccine is 94% effective, but only after receiving 2 doses. Many of you are also wondering if we're going to get the Janssen vaccine here in Europe, also known as the Johnson & Johnson vaccine. The simple answer is yes. We'll be getting the Janssen vaccine over the next coming weeks. The Janssen vaccine is a single-dose COVID vaccine that doesn't have the extreme cold storage requirements that the mRNA vaccines like Moderna have. As a result, we'll be using this initial distribution to vaccinate our soldiers who are forward deployed to places where we don't have robust medical treatment facilities. Please stay tuned to your clinic's social media and web channels for the latest information on where we are in the tiered distribution process and when it's your turn to be vaccinated. The clinics post updates every Monday morning, so check there first for the latest update. I've said this before, but I'll say it again. I strongly believe that all 3 of the vaccines that have been approved for emergency use by the FDA are extremely safe and effective. And while they are absolutely voluntary, I encourage you to make an informed decision to protect yourself, your family, your fellow soldiers, and your community. And finally, we continue to recommend wearing masks, washing your hands often, and practicing physical distancing for everyone until the pandemic risk of COVID-19 is substantially reduced. We appreciate your continued patience with our staff who are doing their best to vaccinate the community as quickly as we can while doing so safely. Thank you for joining us in the fight to move past this pandemic. Army Medicine, Army Strong.